government, I helped you get up into the
And you helped me know how to watch the boiler.
That's right, that's right. But look, my question, John, and I know you'll give me a truthful answer. I don't know how, like your wages and all those in Madison, and then like our teachers union, now, are they up for raises this year?
Statewide, in the 426 school districts, those are all bargain wages.
Right, but now my question is, John, I pay $7,000 a year for health insurance, and my taxes are over $3,000. Now I'm on a very limited thing, and I don't want to see my house show up in the paper like every day. There's 5 pages of things. In fact, I went to find out today, I got to go to the county. I want to know how many years I can live in my house if I don't pay my taxes. And I'm serious. I don't want to be on that page, and I paid my taxes all my life. And I never asked for anything. But I think it's time that the teachers' unions and all of these other people pay some of their insurance, so I won't lose mine. It's not fair that I should lose mine and pay for somebody else to have a Cadillac and play for. I don't have no dentistry, no hearing, no glasses. I'm not covered for that, and I've got to bear what you can get, and it's costing me a fortune. But I want to know what you think about that. Thank you.
I'm glad you brought that up, Don. Since the early 90s, the teachers' unions have been under something called the Qualified Economic Offer language. That's different from all other public bargaining in the state of Wisconsin. Under that language, they were essentially guaranteed 3.8% salary and benefits. And what happened to Wisconsin teachers is, compared to their peers nationally, their salaries were suppressed by the QEO. But you know what happened to their benefits? Because they were guaranteed maintenance of benefits under QEO. They ended up with, you call it Cadillac benefits. I think they're very good benefits. I used to have those benefits as a teacher years ago. From talking to people, they seem to exceed what I have and what most people have. In private industry, many people are paying 20% of the premium out of their pockets, you know, when it gets taken out of their paycheck, and their working people are paying sizable amounts. And retirees are often limited by various account methods, and they say, you can retire now, but here's what you have to spend on your health care. Go out and go shopping. So there's tremendous pressure on almost everybody. And the public employees have better than average health care. The teachers have better than average health care. WEA Trust, which is associated with the teachers union, is in the healthcare business. They provide very reasonably priced, high level of service health insurance around the state of Wisconsin. I won't deny that, Don, but there's a couple things that are going on. One is, if you have a wife who's working for the school district and a husband who's working somewhere else, where do you think they take their family benefits from for health care? You know? So you're getting a tax dollar shifting because those benefits are better than average. And I'm not going to stand here and say, I don't like having the teachers of Racine having such nice health care. I wish this on everybody, you know. But the fact is, those higher level of health care benefits compared to other people make it so that there's a kind of a spread of that system around the community. And the taxpayers are paying for all that. You're paying for the teacher and the spouse and the kids and whatever on those policies. I have said to my teacher friends, okay, you worked years and years to get rid of QEO. Now you know what's going to happen? We're in terrible economic times, and local economic factors are considered in your bargaining. You're not going to do that well. Your bargaining doesn't start with this almost guaranteed 3.8 anymore. It starts at 0. You're in the same boat of all the other public employees, and you are going to see that your health benefits were protected under the QEO in a way that they're not at the bargaining table under the new system where the QEO has been eliminated. I supported getting rid of the QEO as an element of fairness. When the teachers sit down at the table in these next contracts, they're going to be like county workers, city workers, everybody else sitting down there and trying to figure out how to get the best they can, and the representatives of those governments are going to bargain hard and do what they can to be reasonable on behalf of the taxpayers. I have said to my teacher friends, it's important for you to remember those local economic conditions. Don't get greedy and be reasonable about your demands. But I won't bet money on it, but I'm pretty sure that the health care benefit differential between the private sector and the teachers that differential is going to close and close and close with this new bargaining system.
Well, it's good times, John, that's fine, but everybody's got to suffer.
John, just to let you